Lead poisoning in Syracuse in particular has been a real problem for a long time, but a lot of these upstate cities that were industrial cities have lead paint in the houses, lead dust in the soils, and it's a very severe problem for especially our children.
So for my family, lead poisoning is now generational. My experience with lead poisoning started 4 decades ago when my brother was lead poisoned, literally just a few blocks from where we're standing now. He was 2 years old at the time. We knew a lot less about lead than we do now. So his lead levels got pretty high. He seized every day of his life from 2 until he was 13. Now at 44, he has outlived both of my parents. And so myself and my other siblings are responsible for his care now. Essentially, we have an 8-year-old and a 44-year-old body. You fast forward 4 decades later, when we thought lead was essentially solved, and one of my grandchildren became poisoned in this home, which we were the renters of at the time. We are now the owners. And this brought up those feelings all over again. What would her future be? What would happen? How do we solve this problem? And we thought we were the 1 in a million, and we weren't.
Unfortunately, early in life especially, lead can deposit in the brain. And once lead gets across the blood-brain barrier and deposits there, it's very difficult to get it out. Our systems don't do a good job of clearing lead, whether it's out of our bones, where it tends to deposit, or out of our brains. And in adults, much less percentage can cross the blood-brain barrier, but in children, it's much more permeable. And so that's the concern, is that it affects learning. And so it's a relative scale. If one child has a blood lead level that's at 1.0 micrograms per deciliter, and another has a level of 5 micrograms per deciliter, that child that's at 5 is going to be learning impaired. Slower learning, less likelihood to graduate high school, and there's actually statistics on higher crime rates.
We can trace the association, not the causality, because that's still something we're working out, but we can show the overlapping of areas of lead poisoning with poor educational performance, with, teen pregnancy, with entry into the criminal justice system, and so on. So there's a whole set of ramifications. In Onondaga County as a whole, we had 25.3 children per 1,000 with lead levels greater than 5 milligrams per deciliter. That compares to 12.1 for the state. For children with lead levels of greater than 10 micrograms per deciliter, in Onondaga County, we had 8.8 children per 1,000, compared to the state of 3.8. Now, within Onondaga County, lead poisoning is greater in the city than it is in the outside of the city.
So there's no need for a child to ever suffer from childhood lead poisoning. You prevent it by simply removing the source of the lead, whether that is lead paint, whether that is lead pipes, whether that is lead found in the child's environment. Syracuse has a large population of homes built pre-1978, and that was the year that lead paint was banned in the U.S. And because there has been a lack of good enforcement for landlords to upkeep those properties, we expose hundreds of children every year to lead. The zip code that you're standing in right now, 13205, if you are a young black male child, you have a 1 in 4 chance of being poisoned in your home.
We passed my bill called the Tenant Dignity and Safe Housing Act, that allows people to essentially sue their landlord over unsafe living conditions and either withhold their rent or get a judgment to allow them to fix the problem. So really trying to make sure that we're putting tools in the hands of people who are trying to protect their children. So there's federal money to try to get lead pipes out of houses or the lead service pipes, replace those so we're not getting lead in drinking water. There is funding at all levels for lead paint removal. I'm working very hard on just trying to build a lot of new housing, because new housing isn't going to have lead paint in it at all.
The city's efforts are primarily in making sure that there's oversight when we come in contact with the housing inventory of the city. That is either through complaint inspection, that's going to be through periodic inspections, which is certificate of use, certificate of adequacy, and of course our rental registry program. When inspectors go in, we're going to be looking to make sure that there's no deterioration or chipping hazards. And if the home is built pre-1978, we're making sure that it passes a visual inspection. And the final piece of that is, in order to pass those inspections, we're requiring what's known as clearance. So we're going to engage you to get lead dust wipe testing to make sure that there is no presence of hazards. I think a little over 700 properties total have come back where there was visually, something to grab onto. Since January, about half of those properties have had their lead violations seen to and closed out. So we are looking at a pretty decent volume. I mean, like, if you are driving through the city, you'll see a few.
Central New York, Onondaga County, they have a particularly great relationship with the city of Syracuse, working on the lead problems that they encounter there. And they work closely with code officials, as well as they have coalitions of community members all working on housing issues, children's health issues. The Lead Safe Central New York Coalition is very active, and Onondaga County has been great in helping to set that up. So that works at the community education level, but also on things like setting up a mobile van, a testing van. Now, one of the challenges is getting all those children at ages 1 and 2 tested to make testing more accessible in the community, so that parents don't necessarily have to bring their children to a pediatrician well baby visit if they can't get out to the doctor, or if that doctor's office doesn't have testing right in the office. This mobile van showing up at community events is another great access point to get your children tested.
There is no price we can put on a child's brain. Imagine having your little baby, and at the age of 2, microscopic dust that you didn't even know was in your home robs your child of their entire future. I watched my parents live through that, and now I take care of my brother every day. I think our future on lead poisoning can be positive. We have families' voices at the table now. There's other organizations like ours around the state who are bringing these voices to the table. But it's important that policymakers listen to us, as directly affected.